Good morning. This is Dr. John Whitcomb explaining this week what is CIRS or biotoxin illness. This is the first in several recordings on this topic. One has to start by first giving acknowledgement to Richie Shoemaker, a family physician in Pocomoke, Maryland, who caught a bear by the tail about 20 years ago and explored and figured out much of this material. But this is a whole new field of medicine that the rest of medicine is going to find out sooner or later. CIRS, C-I-R-S, stands for Chronic Inflammatory Response Syndrome, and it's really all about biotoxins. And it's useful to tell Dr. Shoemaker's story. He lived in a small town in rural Maryland called Pocomoke, where a number of his patients got sick with a mysterious illness. Now, it actually made the news, and the CDC came and investigated and said the folks were all okay, as did Johns Hopkins, as did the state of Maryland. But Dr. Shoemaker persisted, and he believed his patients. And by chance, one of them was having terrible diarrhea, a secretory diarrhea, for which he gave her an old-fashioned cholesterol drug called cholestyramine. And interestingly enough, she got better in just 2 days. But not only did the diarrhea get better, but her brain fog and all the other manifestations of CIRS got better. Well, this led Dr. Shoemaker to start putting together the picture of what this CIRS was. At that time, in his neighborhood, there was a dinoflagellate called Pfiesteria that was going through a bloom and releasing a toxin into the water. We now know that there are a lot of other toxins besides Pfiesteria, some as odd as lionfish toxicity or red tide, but maybe even cipro poisoning or Buruli ulcer. Now this is really rare, but most commonly and right in our face, mold. Now, is it mold? What we found since then, Dr. Shoemaker has found, is that actually it's not the mold itself, but the broken down DNA fragments and pieces and all the other bacteria that live in mold colonies of water-damaged buildings. And to be water damaged, all you need to have is an air conditioner that's leaking and dripping down the wall. And even a home in Arizona can have it. And over the years, Dr. Shoemaker has put this together in a series of 11 steps by how to treat it. But what we now know is that there are a whole host of rather arcane and weird and what sounds like disjointed symptoms that fit together. So if you go to traditional internal medicine and tell somebody you have joint aches and pains and brain fog, and you're so tired you can't get out of bed, and you have a chronic cough, and you've got diarrhea, and you on and on and on, with that many symptoms, your primary doctor will likely throw up their hands in fear, as I've done for most of my life, and say, I don't have a clue what's going on with you. And we give you titles like chronic fatigue syndrome or fibromyalgia, and we give you pills to treat that. Well, this may be mold. What's my opinion? I think this is actually a whole new field of medicine that deserves the dignity of a department status in a medical school. Soon it will be taught to every internal medicine and family doctor. In the meantime, what will work for me? Well, I'm in the process of testing about 50 people so far, and when I take folks who have unexplained symptoms such as this, I've been finding about 90% of them test positive. And the way you start is you measure rather arcane and weird tests like your tissue typing for a transplant, and that tells you you're susceptible. We'll go over that in future recordings, but for now, if you have chronic fatigue syndrome or fibromyalgia, take heart. There may be hope for you. We're calling it CIRS, biotoxin illness, and we'll explain it more in the future. This is Dr. John Whitcomb explaining biotoxin illness, Part 1.